Hey everybody, welcome back to part 3 of Did You Know You Could Speak Up? That's what this series is called, and we are focusing on speaking up and advocating for ourselves. So we already talked about the importance of having access to your patient portal, your dental portal, whatever it is, so there are no surprises in your record that you are unaware of, because keep in mind, every practitioner is going to look at your record and see what is written at face value. Warm handoffs don't always happen, and even still, it matters what's written in the chart. That's what really matters. So in this podcast, what I want to actually talk to you all about, we talked about knowledge is power. I want to talk to you about bedside manners and some strategies to manage practitioners, whether they're medical assistants, dental assistants, nurses, licensed practicing nurses, nurse practitioners, advanced practice providers such as physician assistants, whether they are medical students, residents, interns, researchers, physicians, fellows, attendings, whoever it may be, the person that is at the front desk checking you in, or the person that's at the other desk, sometimes the same person, checking you out, talking about different strategies to manage bedside manners. One of the complaints I see a lot when I read reviews, when I'm looking for practitioners for myself or, loved ones, is this theme, and it's not new, by the way, because I've experienced it, of disrespect, not being fully present, blowing people off, not answering phones in the office, not responding to chart messages, things like that. Those are flags. So if you have the opportunity before you start at a practice, consider driving in just to see what the drive is like. Consider showing up at the practice and just saying you're new to the area, you were coming in for information. Look around, get a feel for the vibe. Maybe the doctor happens to walk out and you can just say hi and see how they respond back to you. But let's talk about you already have established care and you're in a relationship with the physician. Let's say it's an outpatient visit, and this particular provider is not, let's say, providing eye contact. They are on their computer the whole time. Yeah, what about this? What about this? And their attention is on the chart as opposed to having a conversation with you. So what do you do in that situation? Well, here are some strategies. They can ask the question and you just sit in silence. That silence will get their attention. And they'll be like, oh, did you hear the question? I'm like, oh, yes, I just wanted to give you an opportunity to finish typing so that we can make eye contact as I share a response to your question. Oh, I'm sorry. Most of them have no problem with that. They need those gentle reminders because they are very intently trying to pay attention. They're trying to type. They're trying to remember stuff. They're trying not to miss anything. They really do mean well. But sometimes they need that gentle reminder. And a lot of times that's all they need to remember to just look up from the computer or from their cell phones or from their sheet of paper. It could happen either way. So that's a strategy that I've used to not only help foster a relationship, but slow the pace down of the visit. I've noticed a lot of times doctors coming with their roller skates on, especially when they're late. I schedule early morning appointments first available because I don't want the afternoon. We started late, now everything's backed up 30 minutes to 2 hours, which is not okay, right? Especially if you're charging people that's 5 minutes later or canceling appointments and all that. It has to be, you can't have it both ways, practitioners, okay? We got to be on time. And if we're running late, then we need to show grace to patients and clients when they're late. Okay. So one of the things I've done to slow a visit down, and this is actually for those of you know that I, suffered a concussion. I'm going through the healing journey and I'm doing really great, guys. You see these podcasts I'm dropping lately. I'm doing really, really great. We can talk about some of the strategies I've done to get even as far as I've gotten. But that's another podcast for another time. I write the questions down and I have it in front of me so that it's very visible that I have questions. And they'll ask questions. And if it's a question that they ask proactively that I've already have written down, I can just mark it off or write their answer or the response down, or some indicator, whatever I need to do. And what I do is I slow my rate of speech. So step 1 is the silence to get their attention and then to give you a response. Step 2, or another strategy, is talk slower. Don't allow them to rush the visit. You are paying them for this time, right? You're consulting with them about your healthcare, and they owe you that respect to slow down and be present. They also owe you the respect to be on time. So that's something that collectively the industry can work on, is to be early is to be on time. And it's always tricky because a lot of times when a doctor or a practitioner who's usually running late actually shows up early, then their first appointment is late. But it happens. You just stay on schedule and don't punish other patients or clients who are on time by accepting that late patient. Let them know, hey, we are working to stay on schedule. We are so glad you're here. We're going to get you back as soon as we can. But unfortunately, you are late enough to where we can't see you right now because the next patient is already up. Patients, they may not like it. However, I think it's a very respectful response, and it goes a long way, and people don't mind waiting because they know they were late, whether it was their fault or not. So keep that in mind in how you talk to people at the front desk, how you talk to people, because you have no idea what people go through to get to these offices. Traffic. Before we even get to traffic, getting out the house, right? We don't know people's family dynamics. We don't know what happened the night before. We don't know how they're feeling this morning. So that's the first thing. Then they have to get through traffic, whether they're driving or being driven or taking the public transportation. Keep that in mind. There's a lot of stimuli happening there. Then they get to the health facility. They may have to walk across parking lots. They may have to park and walk. They may be stressed about having to pay for parking. They might not be able to find a parking spot. If it's their first time, there's a wayfinding issue. Sometimes these hospitals have some of the worst signage ever. I went to one today. I was like, what? Like it was the worst I've ever seen in my 20-some years of healthcare. So keep that in mind. So when somebody's late, most of the times they're apologetic. Most of the time, some patients don't even say nothing because they feel like, well, y'all late, I can be late. That's not a game anybody wants to get into. So on both sides of the desk here, let's be respectful and just say, hey, thank you, Miss So-and-so or Mr. So-and-so. We're so glad to see you. We're going to get you checked in. Ooh, you're really close to the next appointment time. So we're going to let the doctor know you're here. We'll get you back as soon as we can, but as patients coming on time, it may be hard to squeeze you in right away. It may be a little bit of a wait. Is that okay? Give them the option to say no, reschedule me, or yes, I'll wait. I understand I was late. Traffic was crazy. Thank you so much. Now you got a happy patient in your waiting room versus a disgruntled one. All right. So that's one strategy. In the room, patients, I'm going to go back to patients for a moment. So you're going to slow the rate of speech. You're going to practice silence, or let me say it the other way. Practice silence. If you feel like the practitioner is speaking too quickly, that can be the medical assistant that's rooming you, getting your vitals taken and everything like that. It could be the nurse who's coming in to do whatever he or she needs to do. It can be a medical student coming in. Again, you can decline trainees and students. That is your prerogative. You have that right. You need to make it known. You can also put a chart message about what your preferences are as well. And then when they have you signing your life away, which we're going to do a podcast on that too, by the way. When they have you signing your life away, you can actually put a line through and say decline when it comes to students and trainees and different things. Like if you don't want your stuff involved in research, read all that, because you can decline it. And make sure they scan in what you X'd out and initialed and dated and all that. And make sure you have a copy and you retain that copy. I recommend that you scan that copy to yourself. Keep it on email. Put it in the cloud. Just 3 different places. And that's how you know it's backed up. All right. Enough IT talk. So slow the rate of speech down. Slow the visit down so that you feel like you can think and you're hearing what is being said. If you hear something or a doctor uses a term that you're not familiar with, say, oh, I'm sorry, what was that term? Could you repeat that? Oh, I don't know what that means. Could you please clarify? And you may let them finish the sentence because maybe it'll make sense in context. But always ask, say, I'm not following you. Can you please explain it? Can you draw it for me? You have some doctors who love to draw. They love to teach. And I love doing that sometimes. Draw it out for me, doc. Just draw it out for me. Let's make sure we're on the same page. And I'll do that as well. And it's great. They're like, okay. And then it takes them back to their school days, right? When they were learning and maybe they were tutors or things like that, or somebody drew it for them and now they can teach you. And it's just a mark of a great clinician when they can actually explain what they're talking about. So that's another recommendation that I have for you, is to ask those follow-up questions when things are being said. You don't understand if they're talking too fast, if they're using words with many syllables, whether they are sciencey words, whether meaning anatomy, anatomical words, physiology, whatever it is, you don't understand it. Medication. That should not be a surprise, by the way. I'm going to just say that in this visit too. That's a bedside manners thing. It should never be a surprise, clinicians, practitioners, to patients that you're prescribed medication. That happened to me myself. I was like, I'm sorry. Hello. Had we spoke about this, you would know we don't do medication. Let's find some natural remedies to deal with this, allergic reaction. And you may find they're not equipped because they're not trained in that way, and that's fine. But they should also know, you should have a conversation about pros and cons of taking or not taking medication. All right. Second thing is when a doctor walks in, we're talking bedside manners. When they walk in or a clinician walks in and somebody's with them and they say something like, oh, this is my so-and-so and they're with me today. Yeah, that's not okay. Because again, you have the option to decline. You may not be in the mood for the extra body in the room. Me personally, I don't necessarily care for that. So I was just recently doing occupational therapy, and as soon as I got there for my first visit, the student came up. He was so kind. Hey, my name is so-and-so, and I'm going to be your therapist. I was like, are you asking me or are you telling me? And he repeated himself. He was so confident. And I was like, yeah, I heard you. Are you asking me or are you telling me? And now at this point, he's like, oh my God, what did I do wrong? I'm training, like my preceptor's right there. And she said, yeah, he's going to be your therapist. I said, yeah. Are you asking me or are you telling me? Because my appointment is with you, not with him. And I always like to meet students before I involve them in, and it depends on how serious the situation is. So they both chuckled and said, all right, we get what you're saying. Do you mind? I said, no, I don't mind at all. Come on, buddy. Right? Low stakes. I don't mind engaging with students. Hey, I want somebody to work with me, right? When I'm doing my clinicals. So it's just so important to, again, give respect to each other. So just as a provider and a clinician wants to be respected, then they should also extend that same respect to the patient, and don't just waltz in with an entourage and say, this is my resident, this is my such and that, this is my note taker. No, ask people. Because guess what? When you was in residency and you was a medical student, you were the note taker. Right? So you can do this visit. I won't call any specialties out. You can do this visit without somebody standing there writing your notes, because what happens is these notes is what gets uploaded to the portal and sent to me. That ain't a physician note. Absolutely, that's unacceptable. No. That's not what I'm paying for. I'm paying you, the physician, to document. You should be documenting, and you should be uploading a detailed note that's reflective of that level of training that I'm paying for and that I'm being billed for. So really keep that in mind. You can always say, no, thank you. I do not want a transcriber in here. And I've done that. And so then my doctor's like, they're writing things down, but then they go back and dictate. That's my comfort level. What is your comfort level? Did you know you had that option? Speak up. One more thing I want to say before I close out this short podcast. So we talked about slowing the rate of speech down. We talked about writing your questions down and asking those questions. We talked about asking for clarification if words are being used that are not being used. We also talked about extra bodies in the room. We talked about the students or the trainees or whoever just coming in and no one's asking you permission. If you may not be in that mood today, maybe most of the times you're comfortable with it, but today you're just not in that space. Just kind of feeling like you can speak up and say, hey doc, thank you so much for this invitation. I'm just not in the mood today for extra people in the room. Would you mind asking your student, your trainee, to step out of the room? Right? Very respectful. No one really likes that, right? But it's your right, and you need to know it. You need to feel comfortable speaking up if you're not in that space today. And especially important for our young people, our teenagers, our young adults. that are learning how to ask questions, learning how to own their health, going to the doctors for the first time without their parents. Don't let anybody walk all over you or take advantage of you because you're young. Don't you have the same rights we have that are a little bit older than you? Is what I'll say. You have the same prerogative to make requests and expect that they be honored. So I'll stop this podcast here. There's so much more we can talk about with bedside manners and how to handle conflict. We'll do that in another podcast. Did you know you can speak up? It is okay to ask questions. Thanks for joining me. I'll see you at the next one.